Good evening, wherever you are. This is Diego Vale from ConferenceHype. Our segment will focus on the nephron as a diseased unit, tubular epithelial programs, and the fibrotic niche in CKD. From the 2026 July 23 edition of Kidney International, chronic kidney disease has traditionally been conceptualized through a glomerular lens. However, extensive clinicopathological data show that tubulointerstitial fibrosis and tubular atrophy are stronger predictors of long-term renal outcome than glomerular lesions, even in conditions historically labeled as glomerular. Recent single-cell and spatial multiomic studies further reveal that tubular epithelial cells in chronically diseased kidneys occupy distinct, tightly regulated states that orchestrate inflammation, metabolic reprogramming, and extracellular matrix remodeling within spatially organized fibrotic niches. In this review, we propose a whole nephron framework for CKD progression. We revisit the historical dominance of the glomerular paradigm and summarize evidence that tubulointerstitial damage is a principal structural determinant of renal function. From the 2026 July 23 edition of Kidney International, background, introduction, podocyte adhesion to the glomerular basement membrane is essential for kidney function, and adhesion failure leads to podocyte loss and glomerulosclerosis. Methods: we performed single-cell RNA sequencing on kidneys from doxycycline-inducible podocyte-specific TLN1 knockout mice, an established model of impaired focal adhesion before overt kidney dysfunction. Results: NSF was among the most significantly downregulated genes in TLN1C co-podocytes. Discussion: adhesion impairment suppresses NSF through reduced YAP-TEAD activity, disrupting to Golgi trafficking and integrin maturation, and generating a feed-forward cascade of progressive adhesion failure. From the 2026 July 24 edition of Kidney International, background, introduction, contrast-induced acute kidney injury is a leading cause of hospital-acquired kidney dysfunction, yet its immune-mediated pathogenic mechanisms remain poorly defined. Methods: a prospective cohort of 330 patients undergoing coronary angiography was enrolled, with serial measurement of circulating NETs markers and IL-33 at pre-contrast, 2 and 12-hour time points. Results: CIAKI occurred in 12.1% of patients. Discussion: our study demonstrates that IL-33-enriched NETs promote renal tubular ferroptosis in CIAKI by suppressing AKalpha and impairing beta-catenin nuclear translocation. From the 2026 July 24 edition of Kidney International, background, introduction, Alport syndrome is a hereditary glomerulopathy often associated with ocular abnormalities, yet structural retinal biomarkers remain underutilized in nephrology. Methods: we evaluated TTI max derived from OCT in 93 genetically confirmed patients with AS and 136 controls. Results: TTI max stratified disease severity across genotypes: severe X-linked AS male autosomal recessive AS, 11.8%, intermediate X-linked AS female autosomal dominant AS, 7.381%, controls 5.358%, and remain significantly associated with disease severity after adjustment for age, eGFR, and blood pressure. Discussion: TTI max provides a widely accessible, non-invasive structural biomarker that complements genetic testing and may aid in diagnosing inherited podocytopathies and interpreting COL4 variants of uncertain significance.
This is Conference Hype. Stay with us, coverage continues.
From the 2026 July 24 edition of Kidney International, background, introduction, the molecular diagnosis of autosomal dominant tubulointerstitial kidney disease due to MUC1 variants using high-throughput sequencing methods remains challenging due to the presence of a coding long variable number tandem repeat region wherein most known pathogenic variants are located. Methods: here we use targeted amplicon long-read sequencing to study the MUC1 VNTR in a retrospective cohort study of 78 individuals. Results: VNTR tools proved efficient, requiring seconds or minutes per sample to accurately identify all pathogenic MUC1 frameshift variants in positive controls, including atypical variants. Discussion: we propose a combined approach in which short-read VNTR analysis, using the published alignment-free bioinformatic tools, is used as a first-line test, followed by targeted long-read sequencing with VNTR tools analysis for confirmatory testing and in-depth VNTR characterization. From the 2026 July 24 edition of Kidney International. Background: Introduction. Serum creatinine is a commonly used biomarker for estimating glomerular filtration rate, but is influenced by determinants unrelated to kidney function, including muscle mass, age, sex, diet, and genetic variation. Methods: we analyzed whole genome sequencing and phenotypic data from population-based cohorts in Uganda and South Africa. Results: we described variants associated with EGFR-CR at the GATM locus that were common in African populations, but rare or absent in Europeans. Discussion: African-enriched GATM variants are associated with measurable bias in creatinine-based GFR estimation without evidence of altered kidney function. From the 2026 July 23 edition of Kidney International. Background: Introduction. Microvascular inflammation on kidney biopsy is associated with reduced graft survival following kidney transplantation. Methods: here we retrospectively collected data on EGFR, albuminuria, kidney allograft pathology, donor-specific antibodies, and donor-derived cell-free DNA levels from 70 KT patients both prior to and after initiation of daratumumab treatment. Results: the study cohort consisted of 59 patients diagnosed with antibody-mediated rejection and 11 patients showing DSA and C4d negative MVI. Discussion: our preliminary data suggests efficacy of daratumumab in stabilizing kidney function in KT recipients with MVI. From the 2026 July 23 edition of Kidney International. Background: Introduction. Chronic kidney disease is more prevalent in women than men, but men progress faster to kidney failure. Methods: we compared classification in kidney disease, improving global outcomes GFR stages at baseline by sex based on GFR estimated with European Kidney Function Consortium versus CKD-PI equations in the German CKD study. Results: among GCKD participants, men had a higher urine albumin to creatinine ratio, whereas women had higher eGFR. Discussion: women were more frequently reclassified into a less severe stage of CKD using the European Kidney Function Consortium eGFR than the CKD-PI equation, yet the prognostic performance for KF did not differ significantly between the two equations for both women and men.
This is Conference Hype. Stay with us, coverage continues.
ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 July 23 edition of Kidney International. Background: Introduction. Transcutaneous fluorescein isothiocyanate sinistrin fluorescence enables convenient, minimally invasive estimation of the glomerular filtration rate in rodents. Methods: male and female doll salt-sensitive rats with chronically implanted venous catheters underwent simultaneous measurements of serum and transcutaneous fixed sinistrin fluorescence. Results: in low-salt-fed rats, sex-specific BW-based models explain much of the variability in GFR times HL. Discussion: allowing the sinistrin HL to GFR conversion to vary with BW and salt condition moderately improves the accuracy of HL-based fixed sinistrin GFR estimates compared with a single fixed conversion factor, and captures the transient GFR increase after salt loading. From the 2026 July 24 edition of Kidney International. Background, introduction. The clinical course of systemic amyloidosis reflects the equilibrium between amyloid deposition and clearance, which varies across disease contexts. Methods: kidney biopsies from 708 consecutive patients, with kidney AL treated at the United Kingdom National Amyloidosis Center between 2020-22, and achieved a deep and sustained hematologic response to chemotherapy, were retrospectively stained with anti-CD68 antibody. Results at 5 years: cumulative incidence of renal replacement therapy was 14%, 22%, 40%, and 52% across macrophage scores 0-3 respectively. Discussion in AL amyloidosis. Kidney CD68 plus macrophage infiltration at diagnosis is independently associated with risk of progression to RRT even among patients with deep hematologic response. From the 2026 July 24 edition of Kidney International. Background, introduction. Antibody-mediated rejection remains a leading cause of kidney allograft failure, with both HLA and non-HLA antibodies implicated in its pathogenesis. Methods: we analyzed 571 post-transplant serum samples from 326 patients with histological features of AMR and 164 stable control individuals. Results: NHA-DIA values were significantly higher in patients with AMR compared to controls, regardless of HLA-DSA status. Discussion: post-transplant detection of non-HLA antibodies identifies a distinct subset of AMR with more severe histology and worse graft prognosis, particularly when coexisting with HLA-DSAs. From the 2026 July 23 edition of Kidney International. Background, introduction. Fetal growth restriction is associated with reduced nephron endowment, suggesting increased kidney vulnerability across the life course. Methods: in this nationwide population-based cohort study, we included all individuals born alive in Denmark from August 1995 to February 2022. Results: the cohort comprised 585,624 individuals without birth defects and 21,900 with birth defects. Discussion: being born small for gestational age was associated with an increased risk of AKI from infancy to early adulthood, particularly among individuals with major birth defects.
This is Conference Hype. Stay with us, coverage continues.
That's it for now for Conference Hype's coverage of the July 2026 issue of Kidney International. If anything was missed, tell us which article deserves follow-up. Tag us on X, add your perspective in the comments, share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.